Today we'll be discussing a very interesting comparison between SVT and VT. Now, when we see that these two ECG shows very typical features of tachycardia, the heart rate is almost around 160 to 170 here because only two small boxes, one and a half small box, it is there in between the two R's. It's very simple to calculate the heart rate, that is 300 divided by total number of large squares. So this is one large square and this is more of a half large square. So it is around one and a half. The same way you can simply calculate it by 1500 divided by total number of small square, that is 1, 2, 3, 4, 5, 6, 7 and 8. So you can calculate the same thing by using 1500 divided by number of small squares or 300 divided by large square. Now what we can see in this ECG, uh, this is this ECG typically shows very narrow complex tachycardia. So whenever we are talking about narrow complex means the QRS of usually less than 100 milliseconds, because 100 to 120 we call it as slightly widened, and more than 120 we call it as widened QRS complex. So this contains one small box. It means this QRS is of around 40 milliseconds duration. Narrow QRS complex, highly suggestive SVT almost always. Whereas a wide QRS complex, here we can see that QRS, if you measure from here to here, or if you measure from here to here, it is involving almost four small boxes. If you see here, it is almost involving 3 to 4 small boxes. 1, 2, 3. So here the QRS is around 4 boxes, means around 160 milliseconds. So widened QRS highly may suggest VT, because wide QRS complex can be seen with SVT with aberrancy, with aberrant pathway. So in this case, it can be either ventricular tachycardia or SVT with aberrant pathway. Now, other factors which tells us about SVT versus VT, I have written this so that you can simply remember. Concordance. Concordance means we simply have to go for V1 to V6. So this is V1, V2, V3, V4, V5, V6. So normally if it is SVT, then we should be able to see very good R wave as well as very good S wave. So in this case, in V4 we can very nicely see R wave, in V5 we see R wave, and V6 we see R wave and very small S, and in V1 we see very nice S wave, V2 we see very nice S wave, and V3 also we see very nice S wave. So if you have very good R waves and S waves, it is highly likely that it is SVT only, and this thing will be lost in VT. In VT, you'll not be able to see this thing, so you'll get all the leads in only one direction. So in V1 it is downgoing, V2 it is downgoing, V3 it is downgoing, V4 it is downgoing, V5 it is downgoing, and V6 it is downgoing. So we call this as a negative concordance. Negative concordance means uh, all the QRS complexes or the QS complexes are in one direction only. Either they will be all positive or all they will be negative. So in this case, it is negative concordance, because all these complexes show negative trend only. So presence of this typical negative or positive concordance always almost suggests VT only. Uh, then next feature is absence of QRS in the precordial region. As I just told you, the similar thing can be explained in different way, that in V1 to V6, we can very clearly make out that this is QRS complex. This is a typical QRS complex. But this QRS complex will not be very much easy to appreciate, or will not be a clear cut to identify in ventricular tachycardia. So you can see it is not clear that where it is Q wave or S wave or P wave or T wave. It is not at all there. But in SVT, you can definitely make out the QRS complex. So this again goes in favor of this is SVT and this is 100% VT. Other things is what we can see is RS interval. If it is more than 100 milliseconds, it highly suggests VT. So RS duration of more than 100 milliseconds, we can simply calculate it from here, that the R wave starts here, and the S means the nadir of S, that is the lowest point of S wave. So this is the nadir of S wave. So we can see one box, two box, three box, and three and a half box, means it is around 130 milliseconds. You can again calculate that in different uh, strip also here also, that R wave is starting from here and the nadir of S is around here. So one small box, two small box, three small box, and four small box. So this R to nadir, that is the lowest point of S wave, is around 160 milliseconds. So whenever it is more than 100 milliseconds, it almost always suggests VT. Just see here, this is this beginning of R and this is the nadir of S. So it is hardly two boxes. One and two means it is around 80 milliseconds. You pick any QRS complex, so beginning of R is here and peak of the nadir of S is here. It is only hardly one and half, means around 60 milliseconds. So whenever this R to nadir of S is more than 100 millisecond, it suggests VT and not SVT. So in this case, again, this one more thing also suggests that it is this ECG strip shows SVT, whereas this suggests VT. Apart from that, AV dissociation is very, very important and interesting finding, but it is difficult to explain in this thing. So I'll explain that in a different ECG, because we are not able to discern P waves in this ECG very, very well. The P waves are not at all there, very, very prominent. So I'll take a very good other ECG. The next is RSR dash pattern. So this RSR dash pattern is very typically seen with SVT, and the this is called most specific sign. So RSS dash R dash pattern with taller left uh, ear, we see that in VT and not in SVT, or what we call it as, it is very good or very specific sign of VT. So in this case, it is that is not there. In fact, this is RSR dash pattern with tall right ear. This is right ear, this is left ear. So uh, this is not suggestive of VT, but we should remember that if the ECG pattern shows this type of RSR dash with taller right ear, then this is very, very highly likely to be VT only. In this case, it is not suggestive, but I just simply thought that you must know this thing. So these are the all points. Apart from that, these are other points also, and I'll try to take them in next session. Thank you.